Hi, my name's Toby Mountjoy, and this is the Autism Show. Hi, welcome to episode 9, and this week we're going to be talking all about assessments. So when parents start to suspect, that their child may have something going on, they are often encouraged to reach out to talk to a professional, to go do an evaluation or an assessment so they can get some accurate information about what's happening and maybe some advice about what to do. We would start the show by interviewing some parents to find out what their experiences have been of going through the assessment process.
I wasn't there because they assessed him by himself for maybe an hour and a half. So they have this list of all the things that he need to be doing, like tasks and pronunciation, all that speech as well. He didn't ace any of it. When he came out, the therapist was saying, he's so happy. He's doing all the thing, but not the thing that I asked him to do. And then he's not focused. He can't sit still. So he's running around. He just won't listen. So he was diagnosed with mild autism.
I really empathize with this parent's journey and her words about her experiences. I meet many parents and they have many concerns about the assessment process. They're very worried that they're not sure what's actually going to happen. How long is the assessment going to take? Very worried about how their child is going to perform. Is he going to listen to the instructions or participate with the psychologist or the person doing the test? How would that affect their scores or outcome? This is a big worry. They also are concerned, maybe what is the psychologist looking for when they're going to do these tests? What are they expecting my child to do? Some parents may worry that their child may be very anxious or upset during the evaluation. There are many things to worry about, and it all results in this very big outcome of maybe whether they get a diagnosis or not. It's a really important day that many parents are very worried about, which I really empathize with. So as well as interviewing the parents, we also look to see, from a professional standpoint, what they can offer us in terms of understanding more about this process. So the first person we interviewed was Dr. Bosco, who's a doctor here in Hong Kong.
陳醫生你好，咁今日多謝你咧，就抽空啦，係啦嚟做呢個 interview。咁你個工作入邊都會做到一啲評估咁樣，係咪？可唔可以解釋多少少個流程係點樣啊？
喺香港咧，臨床心理學家可以做評估，兒童精神科醫生可以做評估，兒科醫生喺對於我哋講緊有兒童發展嘅經驗嘅，譬如兒科、腦科或者兒童發展科嘅醫生嚟講可以做評估。咁但係每人嘅角色有陣時我哋評估嘅工具會有唔同，最多人用嘅最大路嘅我哋所謂 ADOS。咁其實我哋講緊嘅都係要包括咗好詳細嘅問證，係從父母嘅角度、父母嘅觀察，加埋我哋嘅臨床觀察小朋友嘅行為表現。咁睇下佢嗰個我哋所謂嘅 social thinking， 即係社交個思想係點，睇下佢嗰個社交技巧係點樣，佢有冇一啲自閉症嘅症狀走出嚟。咁所以一般個評估咧都起碼用上最少2個鐘頭或以上嘅時間，因為我哋需要問一個好詳細嘅一個病歷，加埋我哋要經用評估嘅工具輔助我哋去睇埋小朋友個行為嘅表現，而作出最後一個嘅診斷啦。而家我哋講緊自閉症嘅定義就係自閉症譜系啦，大部分我哋都係用緊 DSM-5， 而家係最新嘅一個自閉症譜系嗰個嘅診斷嗰個範圍。咁所以如果佢符合翻嘅時候，我哋加埋我哋嘅臨床經驗去睇完嘅時候，我哋就會評估到究竟小朋友有冇患上我哋叫自閉症譜系嘅問題啦。其實我哋最重點就係睇翻小朋友個案，佢哋邊一方面強，邊一方面弱，邊一方面出現問題咧，我哋早啲去察覺，早啲去同佢做一啲嘅發展嘅訓練啊，去做一啲嘅幫助治療嘅幫助咧，就可以幫得到呢班小朋友。
I also wanted to interview Dr. Angel Au. She's been a clinical psychologist for very many years. I wanted to ask her a little bit more about, what happens in an assessment, what do children, have to do, and, what kinds of things parents might do to prepare for the assessment, or is there anything they need to be aware of before they go?
Hi, Angel. Hi. So I heard that a lot of people use ADOS as an assessment tool. Can you share with us more about what ADOS is and what you expect the child to do during ADOS?
Sure. Yes, one part of the diagnostic assessment is to see the child and also interact with the child. We want to observe their social, play, and communication behaviors. So for this part, a lot of people use the ADOS, which stands for Autism Diagnostic and Observation Schedule. What it really does is that it presents the child with a number of toys and activities common for the age groups, and also expressive language levels, making it easier for us to observe the symptoms of ASD, if any. So, for example, for preschooler, it includes a lot of fun cause and effect activities, make-believe figurines, toys, and story picture books. I usually will focus on whether there are any stereotypical behaviors or sensory interests, whether the child shows interest in different activities, how do they play with these toys, how imaginative are they in the use of materials, do they engage in any make-believe play? If yes, then how varied are the themes of their play? How do they interact with others? It's not just interacting with me, it's also interacting with like maybe the parents or the caregivers in the room as well. Do they spontaneously join in a play? And also how do they sustain, these play interactions? Do they take turn to initiate as well? So, and also under what kind of context will they initiate? Do they just request for something? Or are they, trying to share what they enjoy with others? If they speak, then I will also need to observe the quality of the speech. Not just, what words they use, but also the nonverbal expressions as well, such as their eye contact, their facial expressions, and gesture in the communication. So while observing and interacting with the child, I also check with the parents about my observation. How consistent are these behaviors? Like obviously, I want to make sure that the child is not only having a bad day. I want to make sure that these behaviors that I observed, are also not only specific to this appointment, to my clinic. I want to make sure that there is a consistency there. So if the child is at school, I usually will ask parents to have their consent to talk to the teachers, and sometimes maybe a school observation is also necessary. So the whole idea is to know about the consistency of the child's behaviors and also how it happens in natural settings. A lot of questions keep going. So, and the question also will include, so how do these behaviors that I just observed, how do maybe symptoms of ASD, how do they affect this child's particular daily functioning? So I usually proceed to interview the parents using the Vineland Adaptive Behavior Scale to know how this child's communication, socialization, their living skills, are they adequate for their own natural daily settings?
So I heard that parents will be asked a lot of questions during the interview. How will you advise our parents to prepare for the interview?
Tell their boss that they won't be coming to work that day. And on top of that, yes, we need a very, very detailed interview with the parents. Well, since ASD is a developmental disorder, what that means is that, behaviors that we're seeing, they do not develop over the night, or are they the results of any stressful events? They are actually persistent throughout their earlier development, although some of the symptoms, they might not have unfolded themselves too early. So I'll take a very detailed developmental history about the child's early years. I understand some parents work full-time, and the children are usually taken care of by their helpers and grandparents. And so some parents told me that it's more like a memory test for them. So I'll advise parents to go through maybe some earlier records or even photos before the clinic visit so that they know the developmental milestones of their children. So apart from early developmental history, I usually ask a lot of questions about their family history, pregnancy, birth history, and also the child's medical history. This is because there are conditions that are known to have a higher risk associated with ASD, and at the same time, there are certain disorders which also have similar presentations to ASD. So having a chat with the grandparents or other knowledgeable relatives to learn more about the family history before coming for the assessment will be very helpful.
And if your child isn't participating or doing so well at answering the questions, I know it's very frustrating for parents when sometimes the psychologist will ask a question or give an instruction and it's something you know your child can follow, but they don't for whatever reason. This is very, very typical in the assessment process, and professionals are very well trained to understand this, and they will take all of those things into account when they're thinking about your child's case. So even if your child isn't so well behaved during the assessment, don't worry. It's still very worthwhile to go visit a professional to get some advice, and can also give us insight into the profile of the student and what difficulties they may be having at that time. So one last piece of the puzzle is to look at, okay, once the assessment's been completed, what do we get out of that? There's a lot of information that's collected during that process, and we feel it's a very, very important thing for professionals to spend time with parents. It's a big change and a big diagnosis. Parents will have a lot of questions, be very worried about the future. And so I interviewed Dr. BJ Freeman to talk about that process and what parents should be expecting, and how professionals should be delivering the messages, and how to spend the time with the families after the assessment's been finished.
I think it's really important to give feedback to parents. You can't just say to a parent, your child has autism, goodbye. And too many clinicians do this. They spend a few minutes, and it's not a hard diagnosis to make, but they don't take the time to really try to understand the dynamics in the family as well. And you have to do that. I haven't done my job if I haven't answered all the parents' questions. So often I'll have them come back. I'll have them go, you hit people with a diagnosis. I also like to also give them something to do that's going to be positive, like seeking services, and so that they feel like they're doing something for the child. And then we have them come back and answer questions, any questions they have. And like I said, I haven't done my job until I've answered all the questions.
So I hope this episode helps you to understand a lot more about what to expect with assessment and maybe what you can gain from doing one. I strongly recommend any parent who's got any of the slightest worries about their child to go visit a professional. The worst case scenario is that they may share with you that there's something that is happening with your child and be able to provide you advice and guidance on what you can do. As we know, early intensive intervention is a really important thing for the children that we see. In the best case scenario, they'll tell you, that everything's okay and not to worry, and you can put your worries to one side. So in either outcome, you're either going to be getting advice on what steps to take next, or to, relax and not worry too much. So both outcomes are potentially good for the future. So thanks for watching, and we'll see you next in episode 10. Thank you.